Well, thank you, everybody. Appreciate the opportunity to speak to your community. It's Ryan Graham, Health Commissioner with the Lake County General Health District, and wanted to just go over some of the history of COVID-19 here in Lake County and ways we can combat keeping everyone safe, combat the virus, and get back to work. One thing I want to present to the community is our business enforcement dashboard, just recently developed in partnership with the Lake County GIS program, and it allows us to track cease and desist orders and recommendations that we've had, any violations in compliance with the stay-at-home order. And when residents log in here, they can get the hotline information to report any of these non-compliant businesses, as are often a concern to the community. Primarily, we're getting complaints on either the business not complying or an employee not wanting to comply with the business not seeing it as an essential service. As of about 2 weeks ago, we had 21 cease and desist and 23 warnings. And we're continuing to take those complaints either anonymously through the 440-350-2188 number, or if you want more information, send graphics, you can actually send those directly to the COVID-19. I'm going to go back a little bit about why this is so important to continue social distancing and slowly phase back in our work and for economic recovery and health. COVID-19 has potential to cause more deaths and hospitalizations than seasonal flu, primarily because it's just spreading that much more aggressively and exponentially than we've had seen in the past with common viruses. One of the biggest risks, and we talk about wearing masks, and people feel that they don't need to be protected by wearing a mask. But the point of that one is really protecting the others, individuals with heart disease, lung disease, such as asthma, diabetes, or other immune-compromised conditions, because it really does put them at risk for serious major complications. And when we talked about flattening the curve, that was really about helping slow down the number of cases for these at-risk individuals and having the hospital capacity to deal with the number of patients or residents. As you can see here, this is back in the early beginning numbers, March 16th. And testing is so unstable right now, we really do not know what the true numbers will come out, as we know that individuals may be positive without symptoms or may be positive and not able to get a test. But as you can see, it's 7,869 deaths at that time. And looking at the case fatality rate, which is 2.6%, so much less severe than other coronaviruses we've had in the past with SARS and MERS. Nonetheless, if you want these numbers, you can check coronavirus at Johns Hopkins University, have an excellent up-to-date dashboard of all across the United States, other countries, and in local areas. So we all know that the case fatality rate of seasonal influenza is about 0.1%. So even with a 2% case fatality rate, meaning your chances of having complications and passing away is 20 times more likely than seasonal flu. It's estimated that 15 or 20% of individuals will have these severe symptoms, and about that same number will have symptoms that they don't even really realize that they have. Maybe they're just not feeling under the weather. So it's very, very tricky. Most of the individuals passing away are from the flu is a secondary mortality issue. It's either heart failure, lung failure, acute respiratory failure, or things that are actually putting people in the hospital and unfortunately passing away. Why are we so concerned about this as compared to H1N1? H1N1 back in 2009, 2010, there was some vaccine that was in process that we could copy very quickly. With the COVID-19, there's no vaccine, no specific FDA-approved medication. If anything's out there right now, it's very early. Treatment is primarily keeping you safe and ventilated, keeping the oxygen flowing to your body if you're in a severe case hospital. And people who are mildly ill with COVID-19 should isolate in their homes. We're very big on transparency. We feel that we need to get this information out to the community as quickly as possible. This is 34 days into the event when we started putting these situation reports out to key leaderships in the community. 168 cases to date as of yesterday, 51 hospitalizations, and 7 deaths, which is extremely good. It's unfortunate we lost that many, but as far as numbers, we're doing pretty well in Lake County. I'll go back to the pair. So if you want these are on our website. They go out to your community managers, mayors, everyone in the community. We can get these out to keep you on track of what's going on and how you can protect your family. Some resources are always added here as we get new resources if you track these backwards. But the one thing we really want to talk about is the area here where this is reports in Lake County. So in the early number of cases, you can see the percentage is high. If you have one case and you go to two, that's 100% increase. Seems very significant. What you want to look at is here how we're doing. So while these cumulative cases seem somewhat shocking and scary to many, seeing these cases go up, what we're really looking at is as we begin to social distance here early, late March, early April, we're seeing these 10 and 8, 14 new cases stay very, very low and very, very tight. This was some weekend, I think it was Mother's Day, I forget what the holiday was. Easter, we expected a spike, staying very, very tight. When you compare this to Ohio, you can see they're a little bit bumpier, and they were looking at this exponential increase over here, where you see these cases really jetting up. And as we tighten down the stay at home, you can really see those numbers begin to fall away. But again, you want to look at this. So we're not always following 168 cases. In our case in Lake County, we might be doing 40 at a time, but they're on the grid on our records for about 2 weeks, 14 days, depending longer if they need recovery time. So when you kind of compare these together, you can see what it could look like for the state. Here, where we're climbing up more aggressively, we've actually done a very, very good job working with our business community, our hospitals, and our partners to keep this number extremely low and tight. Now, as we move ahead with this going back to work safely, this fresh start, these numbers begin to climb. You're going to see reactions from the local Department of Health here at the Lake County. You're also going to see some state maneuvering or delaying of fully opening business back up because when they want to control that number. So really, President Trump recommended a 3 kind of phase approach. And this is what we're going to watch. We're going to look at trying to make sure we're using current data, looking at the most vulnerable population as we return to an economic stability. We're going to be looking at symptoms, cases, and hospital data to do that. One of the things that will still continue after May 1st with these new guidelines is that social distancing is still going to be necessary. We really do not want to see those numbers increase. So again, the prevention of a virus, if it's seasonal flu or if it's COVID-19, these are the standards that we're going to have in place everywhere after May 1st, and we should have had them before that. This will become more of a way of life as we move ahead. Certainly stay at home when you're sick. Mostly avoid touching your nose and face. That those membranes of your eyes, your nose, your mouth can absorb a virus very, very easily. And many times that's where the contact comes out with it. Social distancing is the biggest thing. And this is challenging for businesses. They have a machinist floor or the office meetings. It's just anything you look at as far as a business or employment, you're going to get close to people. You're serving people. You're working with your coworkers. So this is very, very difficult. So as you return to work, as your employers bring you back to work, you want to be conscientious of what duties do you really have to do? How can those be modified to provide additional spacing? And again, as those businesses may or may not knowingly violate some of the compliance, it's good to communicate with them first before calling the health department. Give the employer a chance to address any situations that may be deficient. Key elements you're going to see as we move ahead with plans. The governor gave some direction that if you need approval of a plan, we certainly can't do that, but we can advise on your plan if you're looking at bringing your staff back and you want to be as proactive as possible and compliant as possible, which we heavily encourage. We will be putting a team together, actually effective today, that'll be consulting with businesses as they call in to help them prepare. But you're starting to see innovations like this where these are plexiglass shields so that you can still get your work done but provide protection between you and the client or patient or employee. So we're pushing family preparedness at home, system evaluation, hazard prevention control, all these bigger things that we'd like to see individuals work together and come on the same page. Things we're going to have to get used to that we may not currently be doing, but as these work gets back to normal and we're looking at a potential resurgence or increase in the virus in September towards fall, any of these things you can begin to practice as an employer or employee, or if you're in a position to make these changes. We should be looking towards endorsing video interviews, working from home at any time we can, keeping meetings small and brief, and halting them if possible, work by webinar and or phone. Becoming more attuned with the supply chain to see where your employees may be flying in or out of as far as other countries, and what personal protective equipment they may need to be protected. We're looking at administrative controls and work practices. Again, these are very common ones. For employers, this is difficult. You have a business to run, but we do know that you need your employees to stay home if they can. Primarily, we're recommending that they do a self-assessment, report to you either by email or phone or other mechanism, that they've checked their temperature in the morning, they're aware of their family symptoms or their own symptoms of illness, especially anything that parallels flu-like symptoms that COVID-19 is known for. Again, these are just policies we need to put in place. So there's been some adjustments, but we'd like to see these be full-fledged policies. We want to make sure that staff feel safe that they're working from home, that they're encouraged and supported and not retaliated against. And using any kind of technology that we have to decrease the distancing between two individuals. It's really about how do you get your job completed efficiently without becoming within that 6-foot perimeter or any closer. We recommend everyone washing their hands and removing gloves when soiled, looking at the high touch areas, telephones, keyboards, and other areas that need to be cleaned. As health commissioner, you kind of worry about these individuals going back to work, kind of forgetting about the urgency. It's kind of everybody wants to jump back to return to normalcy as quickly as they can. But we really do need to have everybody look at how we do this for minimizing group and contacts. Workplace and community connections. These are where the big breakouts happen. So we're working on things called contact tracing. So that means when an individual is either presumptive to have the COVID-19 or suspected or actually confirmed with that, we need to do a trace back for the last 14 days to see who they may have came in contact with. And those events where there's not a roster or a list or an employee list, like school, sports, events, social services, high-density coworkers, it's very hard to track these cases. We could be tracking 500 plus individuals with a company just because of one positive COVID-19 infection. And any kind of aiding clients, customer instruction, serving customers, our job duties are going to put you a little bit more at risk. And we want to be conscientious of who you're keeping in contact with. If there's a list that you can maintain, we do recommend employers do that. With Governor DeWine, we realize that schools are still going to be closed. Dining restaurants and bars are still closed, unfortunately. Any kind of cosmetic or beauty businesses, older daycares, entertainment, recreation gyms. These are just facilities where it's very hard to keep people isolated. No matter of gyms, you're having a lot of sweat and other bodily fluids exchanged, and just close personal contact where it's not there yet. And we hope that as this moves on, if our numbers stay low, these can be put back in place rather quickly. The Responsible Restart Ohio is just having an awareness of, as an employer, as an employee, to report any kind of illness that may be COVID-19 related as testing availability comes up, and the state's looking at testing mass populations to see what the real prevalence of the disease is. We know that it's out there, but we do need those reports coming in so that we can follow up with them, primarily provide education. It's not something that somebody should fear as far as that goes. We really do keep your information anonymous. And if there is a positive COVID-19, you're best suited to call us so we can work with your HR department to help you guide through the process of getting your employees back to work and having some confidence that they believe you did the right thing. This is a summary sheet for the back to work guiding principles. I just want to make this available to businesses. If they would like some, they can call us. We'll get numerous ones printed off in color so that you can put these up. But again, it's the same thing. We want to see active participation in doing a daily health assessment, maintaining good hygiene, providing sanitizer, hand washing, and other items for the employees at your business. There's guidance from the state as well as on our Lake County website for consumer retail services. So if you want to empower your employees or if you want to be empowered yourself, please check out this information. It really will help guide you to make a decision on the risk and if we want to take a risk or not. We're mitigating as much as we can. But this will give you some kind of guideline if you want to make sure the business you're frequenting or service is compliant with the law. General office environments, much of this is just the same and really centers around that maintaining that 6-foot distance. We don't consider it an exposure unless you're within 6 feet for greater than 15 minutes. So if you can avoid that throughout the day, between like each little incident or connection, then you'll be well served to stay healthy away from COVID-19. Again, there's manufacturing, distribution, and construction. These are jobs that are often reluctant to wear a mask because it may be hot. They feel that they're not interacting with anybody long enough. And so it's very hard. Also on shop floors or other factories, you get a lot of complaints that there's not enough distancing, not enough bathrooms or hand sanitizer, and those kind of things that make individuals feel protected. And we really do want everybody to be safe and getting back to work. I want to point out there are COVID-19 resources at the Lake County General Health District. That's www.lcghd.org. And we also have Motivate Lake County, which is a broader site that's community supported by multiple community partners and gives you a little bit more in-depth information to plan for your business and your personal health, as well as offering kind of home-based education and wellness opportunities here while we're kind of homebound a little bit more than we've had before with telecommuting and those kind of policies. What we're going to see is concerts, sports, and amusement parks and other events are still going to be locked down for quite a while, I think. Unfortunately, it may breach the rest of the summer. Restaurant and bars are also closed. And primarily, it's very hard to eat food and have a mask on. That's pretty easy to understand. So this wouldn't be one of the last things to open up because that exposure of the 6-foot radius with any kind of bodily fluid or spread of disease would be very easy to do that indoors with that kind of a close droplet, I guess I was making sure I say. Schools and universities, primarily they're struggling with enrollment as it was prior to the COVID-19 response. There's been a big increase in online classroom work, and I think now that this has occurred and schools have been canceled, I think you'll see an increasing amount of schools and universities push more and more towards online learning because it reduces their need for hands-on contact and facility use. Costs go down because you use less maintenance with kids that are doing online learning. They may be more and more comfortable with that as the generations move ahead. Things you want to do after May 21st. It's not time to go throw a party or have large social gatherings. We still recommend small groups of no more than 10, be it at church or in your own backyard barbecue, really minimizing that. Don't give up on washing your hands or using sanitizer. Do not immediately go out and see grandma or great uncle Dan or whoever, because you're really could spread that to these at-risk populations. And if we jump the gun too quickly, they're going to find ourselves back in a lockdown situation. Primarily what we're going to do is tracing. We talked a little bit about that, but tracing now is going to be, if we have a case, one case is just an incident, 2 cases, we consider that an outbreak. So if there's a business, a nursing home, or someone that has 2 cases or more, we're going to consider that an outbreak, send our team in to investigate, and also individuals from Ohio Department of Health will be up looking at those outbreaks or hotspots as they call them. We're going to refine our services. And we also now receiving test kits at the Lake County Health District for skilled nursing facilities, assisted living, and many of those at-risk populations. So we begin to empower the individuals to track and see what those at-risk patients are at, and they have the ability to test, which we have not had previously. It's not time to plan a big vacation and go out to the Bahamas. It's one of these staycation kind of times maybe this year. Go hiking, have picnics, play croquet out in the yard with the kids, but really try to make sure that you're kind of homebound and stay within your community. I just wanted to ask if there's any questions that you may have. The situation continues to change rather rapidly. On Monday, it was everybody had to wear a mask. On Tuesday, it shifted a little bit. To follow the best guidance, again, we encourage you to check out our health department. You have your email addresses for the general. You can call me as health commissioner. We really try to get it back to everybody within 24 hours or less, despite the amount of work we have going on right now.